and welcome to the latest episode of Cardiac Café. Today, we will be discussing living well with your device. We're actually going to be highlighting a patient story. Jana Benassi is going to be talking about her experience of surviving sudden cardiac arrest and living with an ICD. Our guests today are Miss Jana Benassi. She is Mrs. Florida American 2024. As I mentioned, a survivor of sudden cardiac arrest and a very strong and passionate heart health advocate. Joining her and leading the discussion will be Dr. Verma, an electrophysiologist with the Baptist Healthcare Heart and Vascular Institute, as well as a member of our Four Hearts Worldwide Medical Advisory Board. So I want to welcome both of you to this session, and this episode of Cardiac Cafe. Thank you so much for joining us. Today's agenda, just real quick before I turn it over to Dr. Verma and to Jana. As I mentioned, we're going to be talking about surviving sudden cardiac arrest, receiving an ICD, and then from there, learning about the diagnoses that lead to sudden cardiac arrest and how to live well physically, mentally with your device once going through this experience. Jana will also talk a little bit about her CPR awareness and advocacy that she does in telling her story. And at the end, we'll put up some resources for you all to reference for additional information. So with that, I'm actually going to turn it over to Dr. Verma and to Jana Benassi to get us started with this episode.
Well, thank you, Laura. It was very nice of you to invite me again to this Pacemaker Club. And I enjoyed doing the last one, and I'm sure we'll have a great time today as well. And also welcome to Jana, and thank you for sharing your time and volunteering to share your experience with us.
Thank you so much for having me.
Your story is very exciting from what I've heard, and I think we're really looking forward to getting into the details and helping our patients understand how well they can do after a traumatic experience like what you went through.
Yeah.
I'll let you start a little bit. Maybe tell us from the very beginning what happened, and let's hear it.
Yeah. So it was, when they say sudden cardiac arrest, it is really sudden. I was in Brazil spending New Year's with my family, my brother, my sister. We had my daughter at the time was 1.5. I had my 4-year-old, and my brother had their babies. So we were all together at this beautiful, all-inclusive resort, and we're just having fun, spending time with family. And my mom decided to hire a babysitter to help us because there was a lot of small kids, so we could enjoy. And the New Year's Eve, it was beautiful in Brazil. We celebrated at midnight with lots of fireworks, dancing, and it was absolutely fantastic. The next day, everybody was tired. I was feeling very tired. I don't think it was a normal type of tired, now that I recall. So I decided to go to bed early with my daughter. I told my 4-year-old, like, Stella, let's just go to bed. Let's sleep with mommy, because she was out dancing till 2 a.m. And thankfully, my mom got rooms that were joint rooms. So there was just a door in between us and her bedroom. So I went to sleep. Me, my husband, and Stella, my baby Gigi, stayed with the babysitter. And according to my daughter, she woke up daddy because mommy was grasping for air and mommy wouldn't wake up. So at 2 o'clock in the morning, I suffered cardiac arrest while I was asleep. And at the time, and now this is what I tell patients and people that I advocate for. So it's very hard for you to share a story when it's somebody else telling that story for you. So at that moment, everything I know right now that happened to me, it's because somebody told me, because it was almost like I wasn't there. So my husband tries to wake me up. My daughter starts screaming immediately that mommy died. And my husband tries to wake me up like, maybe I'm not feeling well. So I don't think you can imagine that somebody's going through cardiac arrest in the middle of the night. So to start that immediate help, it took him a while to understand what was actually going on. But he knew I wasn't well, so he went to call my mom and ask her for help. As she walked in the room, she did the same thing. She started shaking my legs, trying to wake me up, trying to get some response. And then she took Stella in her arms and left the room to go knock on my brother's and sister's door to ask for more help. Like, Jana isn't well, somebody come help me. And she did it very quietly so she wouldn't scare Stella. At that moment, my husband realized, let me check her pulse. and he realized I didn't have one. So he immediately started CPR. Now, why the advocacy behind CPR? We're going to get that towards the end, but it's because he had at the time done a training on CPR, which he remembered 10 years later. And that's why he decided to do CPR on me. He knew what to do. And so my mom is asking everybody for help. And the babysitter we hired for that vacation came in the room. And she told my husband, put her on the floor. You're doing CPR on a mattress. That's not going to work. They immediately put me on the floor. And according to my husband, it took 45 minutes for the defibrillator to arrive. So he performed CPR. He was going back and forth with the nurse, performing CPR on me while all that, emotional chaos going on with my mom and my daughter. But finally, help arrived and they shocked my heart. They saw I had no rhythm and they shocked my heart and it started beating again, but not at a normal frequency, at a normal beat. That, doctor, you can get into obviously way better than me. Like after you get shocked by an AED, does your heart come back to the regular beat? Anyways, I didn't expect to have a pacemaker the ordinary way. Lost my memory for a couple of days. It was very difficult. I had a lot of complications in the ICU. I stayed there for 2 weeks. And what I do recall on all of this is a doctor saying we're going to need to implant a pacemaker. And I remember saying, first, I didn't even know what I was doing there, barely what happened to me. And now you're telling me that you want to put a device right underneath my skin where my baby sleeps? I freaked out. I told my husband, no. My husband got mad at me and the doctors. I'm like, guys, you have to figure out a way for this not to be here. I have babies. My babies lean on me. I don't want a device here. I'm like, is there any other way? And the doctor finally, with compassion, he said, yeah, we can, it's harder, but we can implant the pacemaker underneath your muscles, your chest muscles. So by then I knew that there was no way out of this and that what happened to me was serious, even though I wasn't aware of. We did the surgery. I implanted the pacemaker and everything went well. It was very successful surgery. I went home. I recovered well, but it wasn't easy accepting the fact that I had a pacemaker. I told Laura that the beauty of For Hearts is that it gave me peace with my device. For 6 years, I didn't look at my device saying that this is a health insurance. I have a Ferrari inside me. And it was only until finding this organization, knowing that there are people in waiting lists waiting for one, then I decided to heal. So when we talk about exactly what we're talking about here for patients, how do you live well with your device? We can go in many directions. Define what well means. Are you Are you healthy? Like, are you active? Are you okay mentally? Is your heart okay? And finding out that I had cardiac arrest because of long QT syndrome type 3, which is an arrhythmia that happens when you're sleeping. So now there's medications for me to take so I don't have cardiac arrest again. So it was just a big bunch of information thrown at me. I don't think I processed. So I think it took me years to process what I was really feeling, what went on, and the pain that I caused my family. For me, that was the biggest thing. It was the pain that I caused them, it's the trauma that I caused my daughter, and living with not only a pacemaker, but a condition that I need to care for so I won't have another event. So that's scary. Just right there, it's scary.
But that's incredible. That's a, amazing story. Anytime I hear a sudden death survivor story, it's always kudos to the person who was next to you who did CPR and obviously very well because you suffered no neurological injuries. And that's one of the biggest things that early CPR can achieve, even though the defibrillator didn't arrive for 45 minutes. Obviously, the quality of CPR was excellent, getting you blood flow to your brain and all that. So I hope he never has to do the dishes again in your house. So
Just cook dinner.
yeah, definitely. Uh, there's a lot to take in. All your comments you made about the long QT syndrome, and maybe we can talk about that a little bit before we delve into your defibrillator and the impact on you and how you've overcome that. You mentioned that long QT syndrome, the type you have type 3.
Mm-hmm.
And it happens, usually manifests during sleep. So there's different types of long QT syndrome. So we won't get into that too much, but For the viewers, long QT syndrome is an abnormality in the genetics of the heart. So the heart, if you think about it, there's a contraction phase where the heart contracts, and then there's a relaxation phase. And the relaxation phase is as important as the contraction. If the heart doesn't relax properly, then there is a possibility of getting what we call malignant ventricular arrhythmias. So the heart goes into abnormal rhythm. It can lead to cardiac arrest. And long QT syndrome basically means that the heart takes a little bit longer to recover, and that's enough to create the substrate for abnormal rhythms, which in your case, you probably had the perfect storm, had a difficult day the day before, maybe exhaustion, heart rate got a little too low, and then you suffered the arrhythmia from the long QT. And it's always surprising, why does it show up at a certain age?
Yeah, I was only 33.
Yeah, and sometimes we see this in children at younger ages, but it could happen anytime, I suppose. So you were diagnosed with long QT3 syndrome. You had a defibrillator implanted, and now you're probably perfectly safe. So we talked a little bit about the long QT syndrome and how different devices can help treat that. So not only is the defibrillator a backup device for the events that may occur where the cardiac arrest occurs, but the pacemaker part of the device can also help prevent arrhythmias related to long QT. And they do that by pacing the heart at a slightly faster rate. So that whole process where the slow heart rate caused the ventricular fibrillation, that never occurs. So that's kind of a way how these pacemakers and defibrillators help with patients who have long QT syndrome. So I think that's worth mentioning for our viewers.
Yeah, and for me, the medication as well. So my heart can prevent QT from prolonging. Is that correct, doctor? Is that what the
Yes,
medication does?
absolutely.
Yeah.
Absolutely. And different types of long QT require different types of drugs. And so, some patients require a beta blocker, which is a very commonly used drug, and then others require different kinds of medications.
Yeah, and I
So,
feel like in my life for long QT, especially arrhythmias, right? I feel better when I'm properly hydrated, when I ate well. I don't allow myself to go long, like fasting, because I do feel like the medication affects, blood pressure. And you can, in the beginning, it was very hard to adapt. It takes a while for you to adapt to beta blockers. And the more I am very on top of my health, the better I feel.
yeah, for sure. And then, other things that might trigger long QT are if somebody is, let's say, dehydrated, their electrolytes are off, if your potassium level goes down, those kind of things can prolong the QT interval as well. And antibiotics are a big one. Patients
Yes, I was
don't
thinking about
necessarily,
that.
yeah, they don't necessarily have to have a congenital long QT syndrome. You can prolong the QT if some of the medications are given, such as there's ciprofloxacin, some of the antibiotics that we use. They are notorious for causing QT prolongation. So absolutely, that's something that most patients, should be aware of what the drugs can do, because we get frequent requests for antibiotics, especially in the flu season. You have a viral illness and they'll call and say, hey, can you please give me an antibiotic? But it's not without risk. So I think those things
Yeah.
is worth mentioning to be cautious about use of drugs that aren't totally necessary.
And there are resources in medications if it prolongs QT or not. I think I have credit meds, and when I have a question about certain medications, it gives you all the information that you need if it prolongs or if it doesn't prolong, if it's safe,
Yeah.
if it's not safe. So I think we do have support for, good support for this condition.
Very much. And I think any pharmacist can tell you within a few seconds whether the drug is a potential risk or not. And now, genetics. Was your family tested yet, or are you waiting for some time before that's done?
Going to be tested because I did have in the family 2 uncles that passed away from long QT.
Hmm.
And so genetics is definitely a reason. And I'm going to do the genetic testing
That's
next
great.
year. So to see if my daughters can or cannot have that gene.
Sure. That's a great idea, to be proactive and make sure they're tested.
It's a scare you don't want to have.
Yes. Yes, but I think also, with all the current treatments we have nowadays, it's better to know. And if there's something that needs to be done, then of course, to protect them.
Yeah, and that mindset that we only have to take care of our hearts at after a certain age.
That's correct.
Arrhythmias can happen at any age.
Hmm.
And this is what I feel like we needed to advocate more for, because that was my experience. I was 33 years old. And when I had the implant device, I go to my electrophysiologist, and all I see is the elderly population, their elderly patients. One of them one time looked at me and is like, "What are you doing here?
Hmm.
You shouldn't be here." And so I think bringing that to awareness, I was a healthy woman, exercising, mother of two. I didn't have any signs that I could have a cardiac arrest. I was tired sometimes. I had fainting episodes, but I blamed it on having babies and
Hmm.
tired and not sleeping. So that's also something to care. It's not just caring about patients who have the device, but your loved ones who need to have this awareness. Like, is everything okay? I'm not feeling well. Should I ignore it? Especially women. I think women have more tendencies of ignoring
Sure.
symptoms, and that awareness of, I'm not feeling good. Could it be arrhythmia? Let me go check. Let me go see. Let me talk to somebody, because sometimes it could be just hydration. But to know, the more information we have, the safer we are, and that's the truth. I didn't know that there was even a doctor that was an electrophysiologist. We always think heart attack, and it's usually probably because of something clogged in there. But no, it's the electrical system. It's the electrical part of the heart that was compromised. So the more the information we have, the more we advocate for. I always say this when I have friends over, or I go somewhere to talk about my book or to advocate for CPR. Somebody had breast cancer, and that person felt it was important enough to say something. And she said it so loudly that now when women go to get their annuals done, we know what to do to check on breast cancer. So that was awareness. That was one person standing up and saying, "Guys, listen, this is serious. This is important." So I think that if we break that notion that I need to check on my heart when I'm in my 60s or my 70s, perhaps we will get more people to not go through what I went through, but perhaps find out beforehand to treat
Right.
it and not have it as a surprise as I did.
Yeah, and the technology exists nowadays to do all this. So,
Mm-hmm.
sudden death is still a big problem despite all the knowledge we have and the awareness. And things like CPR awareness, which you're a big proponent for. I think that's great, and it will help save lives. I think we should talk a little bit about your experience after the device. Maybe you can tell us a little bit about the immediate surgical experience, and then maybe a little bit about how you adapted to it. How did you change your lifestyle? Were you exercising the same way? And then about the mental health aspect of it.
I confess that I was very scared of the device. I was not in peace with it. I was not happy with it. And I was not happy with the medication. I was grateful to be alive, but I wasn't happy. Now I can say that for certain I was not happy. But I powered through. I had my little girls to raise. I had a life to live. But 9 months after having the pacemaker implanted, my electrophysiologist told me, when we do the pacemaker reading, the device reading, that one of the leads of the pacemaker was compromised. So at that time, for me, that's when mental health took a huge toll, because I sat down on the floor and I wanted to cry. Cry, 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 because something that was supposed to keep me safe, everybody's telling me, it's great that you have a pacemaker. Now you're safe. Suddenly it's not. I'm not feeling safe. So that at that moment, at that second surgery that I had to do, that's when it hit me. You're
Mm.
not well. Things are not okay. We need to take care of you. We need to take care in ways that you didn't even know you needed to. So that was the moment where my mental health caught my eye, but not in a good way, because I did a lot of things. I was scared to work out. I was very afraid to exercise. I was afraid of my heart beating too fast. I was obsessed with my Apple Watch. I kept looking at my heart rate constantly. Am I okay? Am I okay? Am I okay? Well, that is emotionally exhausting, but that can happen. And the funniest part of my story is that the time that I had cardiac arrest, my husband worked for Abbott, St. Jude at the time.
Mm.
So he knew all about pacemakers. And I would ask him questions, and he's like, I don't know the post surgery. I don't know how patients do after we implant. I'm like, I'm just there to sell, to know that everything went well, and that's it. I don't know all of these details. So for me, I have the device underneath my right side. And so we have the leads here. So I'm always hampering the leads. As far as exercising, I always avoid a lot of movement in my chest, probably because of the experience that I had with the lead. So that scares me. So I'm always very conscious about the body movements that I do.
Sure.
I don't swim. I don't have the courage to. If I do it, I will do that, that other type of swim, which is the stroke, the breaststroke, instead of just moving my shoulders so much. And the exercising part of monitoring my heart rate, the little things that I do, my heart rate goes to 140 and then might start freaking out. So I always try, I don't do high frequency anything anymore. I keep it my strength training, I do Pilates, breathing, maybe out of fear that I will never know because I'm sure it's safe. Know people who have pacemakers and just, do marathons but for me, there's a limit that I do not allow myself to pass, but purely out
Okay.
of fear.
Now you mentioned that you had a lead fracture. Maybe tell us about that, how that happened, because I think that would be of interest to the viewers about,
And it was very interesting. So I stayed 6 months in Brazil because that's where what happened. So I came back to the US in May, and I was in need of finding an electrophysiologist, but I didn't mind to have one so soon because I'm like, well, do I need to? Well, I'll wait. I can wait a little bit. I feel fine. I went to Barcelona with my husband and I was laying down. I started feeling a tingling something. It's very weird, doctor. I don't know if you ever heard patients saying this about their leads before, but I felt it was almost like a piano, somebody playing a piano, and it would go up and down, up and down. And then I told my husband, I'm like, I think I need to go see someone because this feels different. It's not my heart. There was a rhythm to it. It just doesn't feel right. So we did the checkup for the device and they realized that the lead had a noise. And then they did an echo only to see that the lead was fractured. How the lead was fractured, they say that it could happen and, be that one lead that wasn't placed well. I don't know what reason it would cause, but so we needed to do that extraction. And my surgeon at the time said it's good to have it done right now that it's close to your surgery. It hasn't been a year. It's still easily removable. But emotional wise, when I knew I had to go back into surgery, I was a mess. At that time, I didn't think of how good the technology was. I just thought, my God, why me?
Sure. And there's many reasons that leads may fracture. For it to fracture this early after a implant is unusual, but they did the right thing to remove the whole lead and give you a new one. And again, the sensation you felt in your chest, that piano sensation, it could have been a small current leak that you might have felt, or could have been something else unrelated. Most patients, when they feel some sensation around their pacemaker site, it is not of concern. And I don't want people to take this message that I felt something in my pacemaker, maybe my lead's fractured. That would be a very rare presentation of a lead fracture. Most of the time, it is only detected once we do the official interrogation, check the electrical parameters. But for you to feel something, that would kind of a nice warning that you got and
I think
helped you.
so. Yeah, I think it helped me to go to the doctor.
Helped you get the treatment you needed early versus, having to wait for your next visit, which could have been months away. So leads come out easily, if they're new might be in a year, 2 years, everybody scars differently. After some period of time, the leads do scar into the vessels or the vessels scar into the leads, and it becomes more difficult, at which point we have to use special techniques, cutting sheets and lasers, etc., to remove those leads. And anybody who's young your age, we would most certainly want to take out the hardware that doesn't work and not just abandon it. Abandoning leads is another strategy that can be done, but usually that's only for very high risk patients where removing the lead might be very
Put them at
difficult.
risk.
It might be easier to just say, okay, let's just cap it and abandon this lead and add another one.
Yeah, because
So
I always thought about that. Like, if mine is implanted on the right side, why not leave the lead and place it on the other side? But again, that's just patients, brainstorming and not exact, how it's
Sure.
supposed to be done.
Yeah, and then that's a great point you bring up because there's very limited real estate in the chest and in the heart. The veins that the leads go through are small, and if you start cramming leads in one after the other, so this whole concept is called lead management, just meaning that you take the leads out if they're not working when possible, and weighing the risk and benefit of doing that versus just adding leads. So good question, but that would be the answer. That's why. So we've talked a little bit about your issues with the device and tell us how it affected you mentally. And I think you touched upon that a little bit. It affected your confidence in a way to not being able to exercise as vigorously as you did before. Maybe that's one impact we heard. But did it affect you in other ways and other ways in your life that you think you could have done some things differently?
I had to go under psychiatric care.
Hmm.
I was not doing well. It was very difficult moment for me and my family. I couldn't cope with my daughter's post-traumatic stress disorder that she was having. She started developing certain behaviors that were unknown to me. And I wasn't aware that those triggers were because of the cardiac arrest. I'm going to give you an example. She finally was able to visit me at the ICU. So she got me flowers in a little vase. So she starts running down the hallway to give me those flowers to find mommy, but she falls and those flowers they just break. The vase breaks, is on the floor, and she gets very upset, very upset. Following that, I didn't know that. Well, we only talked about it after we had a couple of episodes where we're like, what is going on here? So my husband would always bring me flowers when he went grocery shopping. And Stella would get very mad at those flowers. So she would lock herself in the bathroom. She would scratch herself. She would be really angry. And I thought, like, maybe she's jealous. That would be the natural reaction. Like, and I even told him, like, next time, bring 3 flowers. Don't bring just one. So that's just a weird behavior that I didn't know what was going on. And then one time, again, he brought the flowers. He even brought one for each. And still, she was very upset. Then my mom reminded me, she's like, this is what happened at the hospital. I think that's why she doesn't want to deal with flowers. So I started seeing her behavior. So her trauma started coming out. And that it affects any mom, whether I had an episode or not. We suffer a lot when we see our children upset. So I think dealing with my post-traumatic stress and hers all at the same time was very difficult. Because this conversation that I'm having now, the story that I'm sharing now, I was not able to share for 5 full years. This was a forbidden subject here in my house. It was only after I joined a pageant that I noticed the need and how inspired people were to hear my story and how important my voice was that I started bringing the subject back to the house. So that was very healing, but I never spoke to Stella about what happened to mommy, what went on, my pacemaker, nothing. I pretended nothing happened. And there was this little girl dealing with all of these emotions and not knowing how to cope, to a point where we also needed to seek treatment for her so she could at least figure out some ways to cope with those trigger moments, especially the trigger moments. Another trigger moment that it was very difficult for her, and I believe it still is, was sleeping. She cannot trust herself to put herself to sleep because she's very aware that sleeping, that sensation that you have, like, I'm okay, I can let go, maybe you're not okay. Maybe something can happen. So that trust to something so natural as sleep, it was lost in this little girl. So the struggles were all combined. And I was sharing those struggles, my struggles with my family, Stella's struggles, Ricardo's struggles, my husband's struggles. I couldn't scream at the house, oh my God. And I was screaming because of a cockroach. He would run and say, oh my God, what happened? I'm like, nothing, just a cockroach. And then he would be angry. I'm like, why are you so angry? It's just a cockroach. So I noticed little behaviors from my family that they weren't okay. But to me, to realize that they needed help, that I needed help, that this, it took me a very long time. And again, the survivor guilt, it's very hard to survive and be able to heal and allow yourself to heal. And I say this because you leave surgery, you survived cardiac arrest. It's a huge celebration. It's a huge celebration. My God, you survived. You have no idea what you went through, what you put us through, but you're here. So there's a side of me where I'm like, Okay, I survived. So be thankful for that. So how dare me complain about a pacemaker? How dare me complain about, you know, the cuts and my pain where the device is? I'm alive. It would be very selfish of me to complain. Very selfish. So you lock yourself in.
That's an incredible perspective. And the whole family trauma is something I have actually not heard of before. Maybe we haven't dealt with too many patients with young children who witnessed the event and survivor, the event. So that's incredible. And hopefully with time, it's something that heals fully for her and your husband.
Yeah, the anxiety, we know it's still there. She's older now, so it's easier for her to identify where it triggers her. Now, obviously, we talk about it. It became a movement, it became a heart of hope for us. It's a movement that we do. We talk about CPR, we advocate for it as a family. Levels of activity. I immediately went back to physical therapy after my episode, and I never stopped exercising because I knew it was important and I didn't want to. I didn't want my endorphins. I needed all of that there. And it was almost like I needed my life to go back to normal quickly in a way. But again, always very scared of the device, especially the lead, especially after having the second surgery. Hydration, I mean, I'm here in Florida. It's very, very hot. I definitely felt the toll of not staying hydrated, or when it's too hot, I felt dizzy. And I believe not because of the long QT, but because of the medication. And throughout these 6 years that I had the device, I did have episodes of arrhythmia that really, really scared me. So again, to have that trust to go to my electrophysiologist and have your device is okay, you have no alerts, everything is fine. It's all I beg to hear every time I go, but more time than not, it wasn't the case. So I continued to having episodes. Thankfully, adjusting medication was enough to keep me stable. But it's everything. It's everything. Now I do feel like I really care for myself more in all aspects, mental health. I do the things that I like. I do the things like I take care of myself because I have to. It's like, don't wait until you die to do something. It's like, okay, guys, I've been there. I know this is serious. This is not just a cliche. It's not just a gym telling you to exercise. No, this is real. It can happen. And hydration, eating right, mental health, all of these things. I'm finally in a place where I could combine those and cater it to me.
That's
But
great.
again, it took years.
Yeah. So not only are you, overcoming the long QT issue, you're probably going to live much longer than you would have because you're going to be a
Because
lot,
I'm taking
lot
care
more
of myself.
healthier with everything. And I have seen this in some patients where they have a complete lifestyle change, and something like this can be life changing, not only for themselves, but for people around them. And so I know you've done a lot of work with awareness for certain cardiac arrest, and we'd love to hear a little bit about that if you can.
So one day I decided to join a pageant. I'd never done pageants before. The girls were old enough for me to have a little bit of breathing room. And there's this influencer that I admire very much. She's a mother of 8. And at the time, she was Mrs. American. And one of her posts, she has millions of followers throughout her platform. And she owns a farm. So she's a very hardworking woman, beautiful. And she posts something about if you're a married woman and you want to join. And I thought, oh, maybe I'm going to try. And it was through pageantry that I realized that my voice was important. My voice mattered. It's like, why are you not talking about this? I'm like, well, because it hurts everybody's feelings in my house. And I think it hurts me as well. And it took me a while to process. But being brave enough to speak about it gave me a title of Mrs. Florida 2024. And that title gave me the visibility to find nonprofits and many organizations in need of survivors to speak up. Because that's another thing that we don't have. Survivors don't want to talk about it. We're too scared. It's just so delicate. It's such an intimate moment of our lives that why would you want to get a microphone and tell everybody? So people and nonprofits and organizations started appreciating. It's like, we need you. We need more Janas. I've known of some stories of patients who had cardiac arrest and needed an implantable device, and doctors asking them, like, can you please share your story? No, nobody can know. Otherwise, they're not going to hire me. They're going to think I'm sick. They're going to think I don't function well. So the survivors stay quiet, thinking that people are going to look at them and say, no, you're not going to last long. Or, you have a device. You're probably going to come with health problems. So I started advocating until we advocated even in Tallahassee. So we helped pass a bill with the American Heart Association. So now schools are required to have staffs trained in CPR because cardiac arrest happens in school more than talked about. And we need to protect our kids. Staff needs to know what to do. And during my advocacy, one event that we did, we got 300 people to demonstrate CPR. And this lady told me something very interesting. It really touched my heart. She's like, Jana, but if I see somebody, I'm going to think that person is dead. How do I know if I have to do CPR or not? And I told her, just keep pushing until help comes. You don't know. That's okay, but why give up on that life? And that switched a light on her. She's like, yeah, you're right. If something like that happens, I need to do something.
Right. That's great.
And from that, I wrote a book about my story. It's called Heart of Hope. That movement went to Brazil as well. So we did Coração de Esperança in Brazil. There's just a lot of beautiful things that came from it. And I feel like this is my therapy. This is what keeps me going. This is what keeps me okay when I go to checkups and say, hey, you had an arrhythmia. This movement, talking about it and inspiring survivors to talk about it, inspiring nonprofits to bring your voice louder and louder, to keep shining the light on all of this. And of course, seeing organizations like For Hearts and knowing that there's a waiting list of people that are in need of one of these devices. It's very humbling to me. So I feel all of this really helps me thrive every day and live with a little less fear.
Well, you've done a tremendous job of taking this a life-changing event and changing life, not only for yourself, but a lot of people around you. So congratulations to you and your
Thank you.
family. And we have a slide showing some information about where patients might receive more information about sudden death and cardiac arrhythmias. And you can see that on the screen.
All of those are amazing resources.
They are.
Amazing.
Okay. And Laura, if you have any final comments.
I really just want to say thank you to both of you and to Jana for sharing your story. I think that it's important for us to, from the Pacemaker Club perspective, to understand that it's getting a device is more than just the piece of equipment that's in your chest. There's a world around it, and
Absolutely.
that is the purpose of the Pacemaker Club, really, is for people to have a platform to talk about things that they're going through, to seek support from other patients, to compare experiences, support each other through those experiences. Obviously, it's still best practice to consult your physician and talk to your doctor and communicate with your doctor. But the Pacemaker Club is a place for patients to know that they're not alone, to know that they're, that
Absolutely.
they have support and that there are people who understand what they're going through. Sharing your story is commendable, and I appreciate it. And sharing your energy and your advocacy for all of the organizations, not just ours, but for all of them that work in this space is very important. And we appreciate you and all that you've done in that regard. And of course, Dr. Verma, your expertise in guiding patients to be able to live well with their device and answer the questions and provide the more medical direct answers to things that they may have, I think is just as important. And there's two sides to a coin, two sides to a story. We need both of those to work together. So I just want to say thank you to both of you. I hope that our Pacemaker Club community appreciates and understands what we're trying to present in these cardiac cafes, and doctors and patients sharing their stories and experiences is what we're all about.
Well, thank you. It's been a pleasure. I appreciate the exchange, and Thank you.
Thank you so much.